Good afternoon, class. My name is Jalen Stevenson, and my presentation today will be about ischemic stroke. You may ask yourself, what is ischemic stroke? An ischemic stroke occurs when the blood supply part of the brain is interrupted due to a blockage in the blood vessel, depriving brain tissue of oxygen and nutrients. There are two types of ischemic stroke. One being thrombotic stroke, which occurs when a clot forms in one of the brain's blood vessels, typically due to the buildup of fatty deposits in the blood vessels. Two being embolic stroke, which happens when a clot or other debris, often from the heart, forms elsewhere in the body and travels to the brain, which blocks a smaller artery. Alright, so now we're going to go over some characteristics of ischemic stroke. We're going to go over the sudden symptoms of ischemic stroke. First, being the weakness or paralysis of one side of the body. Alright, two being facial drooping. Three being slurred speech. And lastly, loss of vision. Additional characteristics of ischemic stroke falls under focal neurological deficits. An example of focal neurological deficits is a stroke affecting the right middle cerebral artery, better known as the MCA, which may cause contralateral, which is opposite side, weakness and sensory loss. While having a stroke, the left MCA is affected, which could result in language impairments. Alright, the last characteristic of ischemic stroke is movement impairments. One being paralysis of one side of the body, two being loss of coordination, which can affect your walking, balance, and fine motor control. Three being an increase in muscle tone or stiffness, which can lead to difficulty moving your limbs. And lastly, difficulty articulating speech due to weakness or incoordination of the speech muscles. All right, here are some brain structures that are involved in ischemic stroke. One being primary motor cortex, two being the basal ganglia, three being cerebellum, four being the brainstem, which transfers into locked-in syndrome, and lastly, PCA, which is posterior cerebral artery. All right, the motor cortex, located in the precentral gyrus of the frontal lobe, controls voluntary movements. The basal ganglia, a group of nuclei deep in the brain, are involved in the regulation of voluntary movements, balance, and coordination. The cerebellum plays a crucial role in coordination and balance. The brainstem controls essential functions like breathing, swallowing, and heart rate, as well as basic motor movements such as walking. Locked-in syndrome is a rare but devastating consequence of stroke in the brainstem, where the patient is fully paralyzed but remains conscious and able to move their eyes. The PCA supplies blood to parts of the occipital lobe and temporal lobe, which are involved in vision. Here are some additional fun facts about the prevalence of ischemic stroke throughout the population. Ischemic stroke takes into account approximately 85% of all strokes throughout the population. It is estimated that people that are affected with ischemic stroke happen within 140 to 150 cases per 100,000 people annually. It is noted that stroke risk increases once you hit the ages of 65. For individuals that are above the ages of 65, cases are within the ranges of 400 to 500 cases per 100,000 people annually. And typically men are more prone to experience or have symptoms of ischemic stroke rather than women at a younger age. Thank you for listening to my presentation about ischemic stroke. If you have any questions about ischemic stroke, feel free to ask. Thank you.